Hi, my name is Emily Young, and I'm a fourth year medical student at Harvard Medical School. As a research trainee at the Trauma Imaging Research and Innovation Center at Brigham and Women's Hospital, I have been studying radiologic injury patterns at the intersection of intimate partner violence and suicidal behavior. Intimate partner violence, or IPV, is defined as the physical, sexual, and/or emotional violence between partners or former partners, and it is a well-recognized risk factor for psychiatric disorders. There is increasing evidence of its critical link to suicidal behavior, which encompasses thoughts of suicide, intentional self-harm, and/or suicide attempts. However, there is little research on how these conditions present and overlap in imaging. The work we are presenting at RSNA 2025 is a retrospective study of 1,451 women who reported IPV to our hospital from 2013 to 2018. Our control population of 6,679 women was built from our research patient data registry and matched by age, race, and ethnicity. Using medical classification codes relevant to suicidal behavior, we formed 4 study groups: patients reporting IPV with suicidal behavior, patients reporting IPV without suicidal behavior, patients without a history of IPV but with suicidal behavior, and patients without a history of IPV or suicidal behavior. We had 2 experienced emergency radiologists blindly review the patient imaging reports. We found that within our study cohort, suicidal behavior occurred at a higher frequency among patients reporting IPV versus patients without a history of IPV, at a frequency of 16.7% versus 2.5%. Both IPV and suicidal behavior played independent roles in doubling the overall injury rate compared to patients without a history of intimate partner violence or suicidal behavior. Patients with IPV often sustained head, face, neck, and upper limb injuries. Patients reporting IPV and suicidal behavior suffered over 6 times as many head, face, and neck injuries, almost 4 times as many spinal fractures, 3 times as many deep injuries, and twice as many upper extremity injuries. As for severity, these patients experienced almost twice as many severe injuries and 3 times as many mild injuries. When looking at the independent effects of intimate partner violence versus suicidal behavior, we found that suicidal behavior had a greater impact on the injury rate of upper extremity injuries, while intimate partner violence had a greater impact on head, face, and neck injuries. As suicide remains a leading cause of death worldwide, our evidence of distinct and overlapping injury patterns with intimate partner violence is an important step towards improving detection and providing timely intervention. These findings open the door to improve screening and earlier intervention to better protect these vulnerable populations.